Welcome to WYCE's Community Close-Up, our weekly public affairs program produced in partnership with the Rapidian, our hyper-local news service of the Grand Rapids Community Media Center. Community Close-Up brings you a diverse perspective from community leaders throughout West Michigan. I'm WYCE's Janet Zahn, and it's my pleasure to welcome to our program this week Dr. Wendy Falb, Ph.D., Executive Director of the Literacy Center of West Michigan, online at literacycenterwm.org. Literacy Center, Wendy, has been in operation for many years, sneaking up on your 40th anniversary.
Right, yeah.
And so glad that you were able to take time out of your schedule to just share some of the highlights and the big news about Literacy Center's important work. Tell me a little bit about how Literacy Center impacts our community, because it's bigger than what most people think.
That's right. Thanks, Janet. It's great to be here. So we are the largest community-based organization focused solely on adult education and literacy in the state of Michigan, and we're actually one of the larger ones in the country. We instructed over 1,300 people last year. I think the number was 1,354, with a lot of waiting lists. What makes us quite unique in the adult education world is we really focus on meeting adults where they are in their lives. When we're adults, we're pretty focused on making money, taking care of our families, and it's very difficult to stop your life for a general education. So we try to design our programming to remove literacy and language as a barrier in adult lives. So that might be navigating healthcare. We have a health literacy classes and number of health clinics. It might be, how do I support my child at school and advocate for my child at my child's school? So our family literacy programs in 5 districts. And we do a significant amount of workforce development with different training partners and many different employers.
We'll talk about that workplace literacy in a moment, but I want to focus just a little bit more on the family, because communication in family is so important, and you've got the parents are expected to be able to support their kids in their education process, right? So I'm sure that you found that when the parents' literacy improves, it helps the children as well.
Yeah, absolutely. This is actually how I ended up at the Literacy Center. I was on the Grand Rapids Public School Board and was really scanning all of the literature, all of the legislation, focused on how do we make more equitable outcomes for children in the school system. And I was meeting with then Mayor George Hartwell monthly, and he shared with me about the Literacy Center, and he shared with me about the family literacy program. And it was this 2-generational approach. And the National Center for Families Learning, that they actually coined that term, 2-gen approach. And it made so much sense to me, not just as a school board member I really valued the community school model, where we make the school a place of belonging for parents and a place of social capital for families and communities. But as a parent in the school system, I saw the other parents and knew that because of my education and my positionality within the school district, the outcomes for my kids were going to be much better likely than the other parents. So when I heard about the family literacy program, I'm like, this goes to the heart of this. This helps parents with their own education. It does it in the context of supporting those children's education. And it also helps, parents are their first and most important teacher, but they're also their child's most important advocate. So just navigating a school system and owning that school is their school, and they should be able to speak to the way the school is run. So the family literacy program is what drew me into the Literacy Center, but I soon kind of saw the way in which this could work in many aspects of adult lives, not just in the school system and with families.
It's a fabulous program, and I see that you have various programs working in the school districts with Head Start online and some of the health clinics. So you're broadly based in how you're doing this approach to supporting family literacy improvement. Partly how you do this is, or a big part of how you do this is through the literacy coaching. So you want to talk a little bit about that? It's one of the most amazing parts of the Literacy Center's work, I think.
about a third of our 1,300, or maybe it's more like 25%, are supported by instruction from volunteer coaches. And this is the backbone in the beginning of the Literacy Center. It started out as a literacy council with volunteer coaches. And when I first got to the Literacy Center, I knew instructional quality was such a key piece of education. So I literally thought, really, we just have some yahoo from the community and we pair them? But what I didn't understand then, but what I do understand now, is the power of relationship in that model and that theory. And the literacy coaches would say, look, I am learning as much as my learner. And to see the power of how those pairs grow together, how they hold each other accountable, how they introduce each other to their networks, I really believe that this program is strengthening the social fabric in our community. And it's formational not just for the adult learner, but for the volunteer coach as well.
So you have certified staff that does some of the work, and the volunteer coaches do another big chunk of that. So are you always looking for more coaches?
Oh,
is that
absolutely.
a thing that people who are interested in supporting your work could become a coach?
Absolutely. We always have a waiting list. There's a lot of learners that really want to be in that one-on-one relationship. So
how many coaches do you have?
We actually have over 100 right now, like 111, I think was the latest number I heard.
That's amazing.
It is amazing.
Mm-hmm. And yet that's not enough.
Nope. It never is. I mean,
never is.
Yeah. We don't recruit for that program because we always have a waiting list. But if we kind of open the gate a little bit, then, that waiting list will grow quickly. So it's been really exciting to see people in the somewhat anti-immigrant context we're living in. It's been really heartening to see community members step up and say, what can I do? How can I affirm and support immigrants and newcomers in our community? But we also work with native speakers of English. So really amazing elders who want to improve their reading and writing to be a model to their grandchildren. People coming out of incarceration that really want to, chart a new path in their lives. So we serve both native and non-native speakers.
Sure. Let's go back to the workforce development pieces, because, you can talk a little bit about it broadly, but I also just want to make sure we talk about your collaboration with Corewell Health, because that is really impressive.
Yeah, so we have a long history of partnering with employers going back a couple decades. So we work in multiple sectors: healthcare, construction, hospitality, multiple employment sectors, in manufacturing. We do a lot with manufacturers. So the idea is we design a class that's contextualized to that workplace. So what is the language and learning you need for your work? And we come on site and hopefully deliver the class during a shift hour. So people also get paid during that time too. It's really PD. And we also do work outside of employers with training partners, kind of pre-employment work, where we partner with WMCAT, Grand Rapids Community College, Goodwill, to do short-term trainings like CNA, machine CNC, that kind of work. We remove English and the language as a barrier to that short-term certification. So we've had this history with both for a very long time. The partnership with Corewell blends these two. So this is very exciting because it's a recognition that there's a lot of people in entry-level jobs that have the ability and the assets to become the foreman, to become the manager. One great example is we have a partnership with Rowan Manufacturing. Oh, yeah. And there was a gentleman who was working in the foundry. And through our English classes, it was revealed that he had an engineering degree back home. And he is now actually the head of their division there. So he went from being in that, to leading their R&D lab. So it's a great example. So the Corewell Health Project is a recognition that we're looking at a real tsunami in terms of need for healthcare positions, with all the baby boomers retiring and also having more healthcare needs, and not seeing the same demographic coming up. We're anticipating, not just locally, but nationally, a huge gap in healthcare workers. Meanwhile, we also have a lot of amazing immigrants and refugees that have healthcare experience in their home country and or have affinity or desire to get into healthcare. So it's recognizing the talent that's untapped and the need. And so this program came with a great grant from the state of Michigan to remove employment and language as a barrier. So folks are employed by Corewell Health, and part-time they're doing entry-level jobs, and part-time they're getting this contextualized ESL to mid-level training. So we are training medical assistants, pharm techs, and CNA over at Corewell. It's been a huge success.
That is really heartening. And I'm also seeing that approximately 1 in 5 learners arrive in the region holding advanced degrees, which you kind of referred to, but that's a stunning number to me. It's like saying 20% of the people that come in have so much skill and learning behind them already that if we can remove the language barrier, they're going to be able to slide right into a role that is more of a leadership. It's going to be more supportive for their families and honors their past experience.
That's exactly it. And also diversifies the workforce since the client base is very diverse. And so it helps with that. Prior to this work, I can't tell you how many times we'd find out someone in our class was a surgeon in their home country, a radiologist, and then they'd be shelving at Walmart or driving Uber.
Yep.
Those are great jobs. Don't get me wrong. And they're grateful for those jobs. But when we have a need for healthcare workers and we have that talent and that asset here, it's really exciting to be able to remove the barriers to help those folks get to those places.
Yeah, I'm very aware. There's people in my life who are refugees, immigrants from other countries, and came with little English, and therefore have been unable to live up to the professional status that they held in other places. So what I'm hearing is maybe I should direct them to Literacy Center.
Yeah.
So what if somebody is in that position where they come with English is their second language, what's the process for getting hooked into your program?
Well, just reach out, give our office a call, and we will direct you there. There's also folks who maybe don't have any healthcare background, but they have an affinity and desire to get in that, and the need is so high.
Yeah, if you're looking for work, that's the place to look.
That's
for
right.
a job, right?
Yeah,
So getting those kind of skills is so important. Literacy Center in our community, doing great work for nearly 40 years. Wendy, I thank you so much for being here today. Is there anything else you want to say about the organization that we haven't talked about?
Well, it's on my mind today because I was out in Holland. One of our staff members and one of our learners went through the naturalization oath ceremony, and it was amazing to go through that. We were one of only 36 organizations nationally to have the USCIS CNIS grant, where we worked with contextualizing ESL to the naturalization process and working with Immigrant Connection here in town to provide the legal filing. And through that partnership, we had well over 100 people that became U.S. citizens. So that funding has been eliminated by the current federal administration, but we are finding small pockets of money here and there, and we're also looking for community members to come in and volunteer. We always have volunteers come in and practice the oral exam. Oh. And I myself have been very humbled by my lack of knowledge that's required to pass that. So it's a great opportunity to kind of refresh your own civic knowledge,
right?
Engage with a new American and help them practice for their citizenship exam.
What a great cherry on the top of this conversation. Thank you so much to my guest, Dr. Wendy Falb, Ph.D. Executive Director of the Literacy Center of West Michigan, online at literacycenterwm.org. You've been listening to WYCE's Community Close-Up, weekly public affairs program in partnership with the Rapidian, a service of Grand Rapids Community Media Center. This is WYCE's Janet Zahn. Thank you for joining us.